Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, we have learnt about the closed and semi-closed and closed circuit functioning. Now, let us learn about the types of the semi-closed circuit. So, in the types of semi-closed circuit, these are also called as Mepelson systems. We call semi-closed circuit as Mepelson systems. There are 6 different types of semi-closed circuit. Okay, what does this semi-closed circuit give? They give high pressure and they also give high resistance to the airflow. They give both high pressure and high resistance to the airflow. Okay, now if you see Mepelson A, this is Mepelson A. This Mepelson A, if you see, the most important thing, only the catching points which you should remember, I will tell you. Here, this is the patient side, right? So one thing is Mepelson A is the circuit of choice for spontaneous ventilation. You should remember this. This Mepelson A is circuit of choice for spontaneous ventilation. Here if you see, fresh gas is away from the patient. You just remember this one thing in Mepelson A, fresh gas flow, that is away from the patient. That is the only important thing which you have to know in this circuit. This fresh gas is away from the patient. The patient is here and fresh gas is here. That is Mepelson A. Mepelson B and Mepelson D and Mepelson E, not only that, and Mepelson F, all the other Mepelsons if you see. Here in all the others, the fresh gas flow is towards the patient. See, this is towards the patient. This is also nearer to the patient. This is Mepelson B. Fresh gas flow is towards the patient. Then we have Mepelson C. In Mepelson C also, the fresh gas flow is nearer to the patient. Then we have Mepelson D. In Mepelson D also, the fresh gas flow is nearer to the patient, even in Mepelson D. Then we have Mepelson E. Even in Mepelson E, the fresh gas flow is nearer to the patient. Then we have Mepelson F. Even in Mepelson F, the fresh gas flow is also nearer to the patient. So except for Mepelson A, in all the other circuits, fresh gas flow is nearer to the patient. Except that in Mepelson A, the fresh gas flow is away from the patient. This is nearer to the patient, nearer to the patient, nearer to the patient. So this is Mepelson A is a unique system where fresh gas is away from the patient, and that is the reason why you can use this Mepelson A in spontaneous ventilation. Next, Mepelson B and Mepelson C are not used now. What is used now is Mepelson D. Okay, so this Mepelson D is the circuit of choice for controlled ventilation. Okay, here if you see, fresh gas is towards the patient. Okay, obviously if you remember one, the rest all are common, right? Next, the next thing which we have is Mepelson E and Mepelson F. Remember, in Mepelson E and Mepelson F, these are actually the pediatric Mepelsons. These are used for small children, pediatric patients. So in Mepelson E is also called as Ayers TPs, or it is also called as inverted T-shaped circuit. So Mepelson E is also called as Ayers TPs or inverted T-shaped circuit. So this Mepelson E is the circuit of choice for pediatric patients. Actually, this Mepelson E is useless as you cannot do any interpretation for either tidal volume. No interpretation for tidal volume is used in Mepelson E. Okay, because see, there is no bag and mask ventilation. There is no bag attached to it. See, if a bag is attached to it, whenever patient is respiring, this bag will inflate and deflate, and as a result you can make sure that the patient is breathing. But in Mepelson E, because no bag is attached, you cannot make sure whether the baby is breathing or not. So this is actually useless. We do not use it at all. Because why? This why is important, because there is no interpretation for tidal volume in this circuit Mepelson E. It is also used in children less than 6 years of age and those who have weight more than 20 kgs. It can be used in less than 6 years of children and more than 20 kgs children. Okay. Then the next circuit is Mepelson F. So if you see, this Mepelson F is Jackson-Reef system or Ayers-TP circuit. Okay, this Mepelson F, it has a bag attached to the expiratory end, and with this bag we can find the tidal volume. In this Mepelson F you can find the tidal volume. It is actually the circuit of choice for controlled and spontaneous ventilation in the pediatric patients. Okay, it is the circuit of choice for controlled and spontaneous ventilation for pediatric patients. So these are the different Mepelson systems. Next in Mepelson we will see the differences between Mepelson type A and Mepelson type B.
Thank you and thank you for watching.